A lung cancer. It is a disease often spoken of in hushed tones, a silent killer that claims lives with alarming stealth. Lung cancer is the leading cause of cancer deaths worldwide, affecting individuals of all ages and backgrounds. By recognizing the subtle cues our bodies provide, we can empower ourselves to act decisively. Early detection is paramount, offering the best chance for successful treatment and survival. Lung cancer, in its early stages, often masquerades as something far less menacing. A persistent cough, a nagging pain in the chest, breathlessness. These symptoms often serve as the opening notes of a much more sinister symphony. The human body constantly sends us signals, subtle cues that something is amiss. Time is of the essence when it comes to lung cancer. Each symptom, no matter how seemingly insignificant, is a potential red flag. In the realm of lung cancer, knowledge is power, and early detection is our most potent weapon. Advances in medical technology have provided us with tools to identify it in its nascent stages. Screening programs, utilizing low-dose CT scans, have emerged as a game changer. These scans offer a non-invasive and highly effective method for identifying lung cancer early. Early detection significantly improves the odds of successful treatment. The human body is a symphony of sounds, most of them reassuringly mundane. A persistent cough can transform from a minor annoyance to a harbinger of something far more serious. It often starts subtly, a persistent tickle in the throat, a nagging urge to clear the airways. Over time, it can intensify, morphing into a deep, hacking cough that produces phlegm. This is the insidious nature of a lung cancer cough. The human chest, a protective cage of bone and muscle, houses some of our most vital organs. When cancer takes root in this vital space, it can manifest as a persistent, often excruciating pain. This pain may be localized or radiate to the back, shoulders, or arms. Any persistent chest pain, particularly with other symptoms like coughing or shortness of breath, warrants immediate medical attention. The location and intensity of the pain can provide clues about the tumor's location and size. Breathing is such a fundamental act that we rarely give it a second thought. For those living with lung cancer, the simple act of drawing breath can become a Herculean effort. Breathlessness or dyspnea is a common symptom, often appearing gradually and worsening over time. Tumors growing in the airways can obstruct airflow, while fluid buildup around the lungs can compress them. The constant struggle for air can lead to anxiety and a debilitating fear of suffocation. Lung cancer is a master of disguise, its early symptoms often mimicking those of far less serious ailments. The persistent cough, a hallmark of lung cancer, is often mistaken for a lingering cold or allergies. Chest pain is often misconstrued as muscle strain or heartburn. Breathlessness is often brushed aside as a sign of aging or poor physical fitness. Recognizing these symptoms as potential red flags is crucial for early diagnosis. A lung cancer often wages a silent war within the body, its early battles fought far from the watchful gaze of the naked eye. Weight loss, often unexplained and dramatic, can be an early warning sign. Fatigue, a crushing weariness, can become a constant companion. Simple tasks, once accomplished with ease, now require Herculean effort. These secondary symptoms can be early indicators that something is amiss. Fatigue in lung cancer is an all-encompassing exhaustion that defies sleep and rest. The body, forced to divert its energy resources towards fighting the tumor, leaves little in reserve for everyday activities. Treatments like chemotherapy and radiation can also take a heavy toll on energy levels. Simple pleasures now seem insurmountable. This constant state of exhaustion can also take a toll on mental health. The human body possesses an impressive ability to maintain equilibrium, even in the face of adversity. However, lung cancer can overwhelm the body's defenses, manifesting in recurrent infections and blood clots. Tumors growing in the airways can obstruct airflow, creating stagnant pockets where bacteria and viruses can thrive. Chemotherapy and radiation can suppress the immune system, making patients more susceptible to infections. Blood clots can form in the deep veins, potentially leading to life-threatening conditions. The human body communicates in a language of its own, a complex symphony of sensations. Some signals like sharp pain or fever command attention, while others whisper subtly. Hoarseness, difficulty swallowing, and swollen lymph nodes can hint at lung cancer. Hoarseness can be an early sign, especially with tumors in the upper lobes. Tumors pressing on the recurrent laryngeal nerve can cause a raspy voice. Persistent hoarseness, without other symptoms, needs further investigation. Difficulty swallowing can occur when a tumor presses on the esophagus. This pressure can make swallowing painful or difficult. Swollen lymph nodes can be a sign of lung cancer. These nodes act as filters, trapping harmful substances. Cancer cells can spread to lymph nodes, causing them to swell. In medicine, a holistic approach is crucial. Lung cancer's diverse symptoms require connecting disparate dots and considering the patient's entire history. Physicians must adopt a comprehensive view, recognizing the body's interconnectedness. The art of medicine intersects with science, requiring knowledge, experience, and empathy. Patients play a crucial role by recognizing changes and communicating openly. Through collaboration, the best outcomes are achieved. Diagnosing lung cancer is rarely straightforward. The disease mimics other ailments, casting doubt and complicating diagnosis. Symptoms like a persistent cough or chest pain can mislead even experienced clinicians. Smoking history further complicates the diagnostic process. Distinguishing between smoking effects and cancer requires careful consideration. Section 2. Through the lens. Imaging tests are indispensable in diagnosing lung cancer, revealing hidden tumors invisible to the naked eye. From chest X-rays to CT scans, these tools guide physicians towards a definitive diagnosis and treatment. Chest X-rays detect lung abnormalities but may miss small tumors. CT scans provide detailed images detecting tumors as small as a few millimeters. MRI scans using magnetic fields are useful for evaluating tumors near the heart or spinal cord. Section 3. The tissue tells the tale. Imaging tests provide clues, but the gold standard for lung cancer diagnosis is a tissue sample for microscopic examination. A biopsy extracts tissue for analysis by a pathologist. The method depends on tumor location, size, and patient health. Bronchoscopy uses a camera to visualize and biopsy larger airway tumors. Needle biopsy is used for deeper lung tumors, guided by imaging. Minimally invasive, often outpatient. Surgical biopsy may be needed for larger samples. Section 4. The quest for clarity. The diagnosis of lung cancer is rarely a singular event. It is instead a process of piecing together a complex puzzle, where each test, each procedure, adds another layer of information, gradually revealing the full picture. It is a quest for clarity, a journey that often involves a team of specialists, each contributing their expertise to ensure the most accurate and timely diagnosis possible. The pathologist, working behind the scenes, plays a crucial role in this quest. Their trained eyes, peering through the lens of a microscope, analyze the biopsy samples, searching for telltale signs of malignancy. They identify the type of lung cancer cells present, their size and shape, their growth pattern, and the presence or absence of certain proteins or genetic mutations that can influence prognosis and guide treatment decisions. Armed with this crucial information, the oncologist, a specialist in cancer treatment, can develop a personalized treatment plan tailored to the individual patient's needs and circumstances. This plan may involve surgery to remove the tumor, radiation therapy to kill the cancer cells, chemotherapy to target and destroy rapidly dividing cells, or a combination of these approaches. Throughout this journey, from the initial suspicion to the final diagnosis and beyond, open communication between the patient and their healthcare team is paramount. Patients need to feel empowered to ask questions, express their concerns, and actively participate in decisions about their care. It is through this collaborative partnership, this shared commitment to understanding and combating the disease, that the best possible outcomes can be achieved. In the battle against lung cancer, time is not a neutral observer. It is a formidable adversary, its passage often tilting the scales in favor of the disease. Lung cancer, in its early stages, often progresses silently, its insidious growth masked by the absence of noticeable symptoms. By the time the telltale signs of a persistent cough, chest pain, or breathlessness emerge, the cancer may have already spread beyond its initial confines, making treatment more challenging and potentially diminishing the odds of a cure. This is the cruel irony of lung cancer. Its early stages, when it is most treatable, are often its quietest. The disease can lurk for years, its presence undetected, as it slowly but steadily gains a foothold within the delicate tissues of the lungs. Each passing day, each week, each month that the cancer remains undiagnosed and untreated provides it with an opportunity to grow, to spread, and to solidify its grip. This underscores the critical importance of early detection, of identifying lung cancer in its nascent stages, before it has had a chance to wreak havoc on the body. Early detection, like a vigilant sentinel, offers the best hope of intercepting the disease in its tracks, of halting its progression before it has a chance to become life-threatening. It is a race against time, a race that can be won with knowledge, awareness, and proactive measures to identify lung cancer in its earliest, most treatable stages. In the ongoing fight against lung cancer, where the stakes are high and the need for effective interventions paramount, early detection emerges as a beacon of hope, a powerful weapon in our arsenal against this formidable foe. While the disease remains a leading cause of cancer-related deaths worldwide, advances in medical technology have provided us with tools capable of identifying lung cancer in its earliest stages, when treatment is most likely to be successful. Low-dose computed tomography, LDCT scans, have emerged as a game-changer in the realm of lung cancer screening. These scans, utilizing lower doses of radiation than traditional CT scans, allow physicians to visualize the lungs in exquisite detail, detecting even the smallest of nodules, those tiny abnormal growths that could potentially represent early-stage lung cancer. Unlike chest X-rays, which often miss small tumors, LDCT scans can pick up on subtle abnormalities that might otherwise go unnoticed. This ability to detect lung cancer in its infancy, before it has had a chance to spread, significantly improves the odds of successful treatment and long-term survival. For individuals deemed at high risk for lung cancer, based on factors such as age, smoking history, and family history of the disease, regular LDCT screening can be a life-saving measure. These screenings, typically conducted annually, provide a critical window of opportunity, allowing physicians to monitor for any suspicious growths and intervene promptly should the need arise. Section 3. Navigating the Maze Screening Guidelines. In the complex world of medical screening, where the decision to test or not to test carries significant implications, guidelines serve as essential roadmaps, helping physicians and patients navigate the often confusing terrain of risk assessment and early detection. Lung cancer screening, with its potential to save lives, but also its limitations and potential for harm, is no exception. The United States Preventive Services Task Force, a respected independent panel of experts in preventative medicine, plays a crucial role in developing evidence-based recommendations for lung cancer screening. These guidelines, based on a thorough review of scientific studies and clinical trials, aim to identify individuals who are most likely to benefit from screening while minimizing potential harms. Currently, the USPSTF recommends annual LDCT screening for individuals who meet the following criteria: ages 50 to 80 years old, a history of at least 20 pack years of smoking, equivalent to smoking 1 pack of cigarettes per day for 20 years, and current smokers or those who quit smoking within the past 15 years. These guidelines, while not without their critics, represent a significant step forward in the effort to combat lung cancer. By targeting screening to those at highest risk, they aim to maximize the benefits of early detection while minimizing unnecessary testing and potential harms, such as false positive results, radiation exposure, and the anxiety and potential complications associated with follow-up procedures. Section 4. Empowerment through awareness. In the fight against lung cancer, knowledge is power, and awareness is the key that unlocks the door to early detection, timely treatment, and ultimately, hope for a healthier future. While medical advancements have provided us with powerful tools to combat this formidable disease, their effectiveness hinges on our collective willingness to educate ourselves, to recognize the signs and symptoms, and to seek medical attention promptly when something feels amiss. Lung cancer awareness is not merely the responsibility of healthcare professionals. It is a shared responsibility, a call to action for individuals, families, communities, and policymakers alike. We must break down the stigma surrounding this disease, dispel the myths that prevent individuals from seeking help, and create a culture where open conversations about lung health are encouraged and celebrated. Imagine a world where every individual understands the risk factors for lung cancer, where the subtle warning signs are recognized and heeded, and where access to early detection and timely treatment is a reality for all. This is the vision that drives lung cancer awareness efforts worldwide, a vision that hinges on our collective commitment to education, advocacy, and support. We must empower ourselves and each other with the knowledge that lung cancer is not a death sentence, especially when detected early. We must advocate for policies that support research, prevention, and access to affordable care. And we must stand in solidarity with those affected by this disease, offering support, encouragement, and hope for a brighter future. Section 1. A Call to Action. Taking Charge of Our Lung Health. We have journeyed through the intricate landscape of lung cancer, exploring its subtle cues, its diagnostic challenges, and the profound importance of early detection. We have confronted the stark realities of this disease, acknowledging its potential to inflict suffering and loss, but we have also encountered the resilience of the human spirit, the unwavering dedication of medical professionals, and the transformative power of scientific advancement. Now, armed with knowledge and a deeper understanding of this complex disease, we must translate awareness into action. The responsibility to protect our lung health rests not solely on the shoulders of doctors and researchers, but on each of us as individuals, as communities, and as a global society. This is a call to action, a collective pledge to prioritize lung health, to be vigilant in recognizing the early warning signs, and to seek medical attention without delay when something feels amiss. It is a call to break down the stigma surrounding lung cancer, to engage in open and honest conversations about this disease, and to support those affected by its reach. Every cough that lingers, Every unexplained ache in the chest, every instance of breathlessness that deviates from the norm deserves our attention. These are the whispers of our bodies, urging us to listen, to investigate, and to take action. Early detection, that pivotal window of opportunity, hinges on our willingness to heed these whispers, to acknowledge their potential significance, and to seek professional guidance. Embracing hope and progress. The fight against lung cancer is a marathon, not a sprint. It is a journey marked by challenges and triumphs. Amidst complexities, there is hope, fueled by researchers and healthcare professionals. Scientific advancements illuminate a brighter future. Together, we strive for a future free from lung cancer.